I think what we're learning is that a fraction of patients will recur with losing the target antigen, as I mentioned. So there are efforts to target additional B-cell lineage molecules. There's a molecule called CD22 that several groups are now actively pursuing, where they design a CAR that either targets both molecules simultaneously or they express two CARs in T cells to give both targets a chance to be recognized. So that's one strategy. I think we also need to think about other ways of improving the quality of the cells that we put in. Many of these patients have had extensive amounts of chemotherapy in the past, and so their T cell pool is quite depleted, actually, and particularly some subsets of T cells that are very important to give durable immunity. Those may be very reduced in numbers. So what we need to be able to do is to isolate out the most effective cells, probably based on their surface phenotype, and engineer those cell products. And then I think we can use lower cell doses and probably provide a higher level of activity. I think a third area of research, and one that my lab has been interested in, is improving CAR design. These chimeric receptors are made based on principles of how a T cell actually signals through the T cell receptor and through co-stimulatory molecules, but we're putting them together in an unnatural way. And that provides different signaling pathways than you would get through a T cell receptor. So it's not a physiological signal. And this may affect the ability of the cells to survive long-term and form a durable memory. So I think there's going to be some real innovations. We've already made some innovations by altering these signaling molecules to tone the signal to be more physiologic, and I think you'll see more of that in the future. So I think both in terms of the CARs themselves, in terms of the T cells that we put them into, and in terms of the targets that we go after, I think you're going to see improvements in the future. So it's going to be an exciting time, I think.